Dear colleagues, here is Dr. Toam Katz from Hamburg, Germany, sharing with you a case of keratoplasty à chaud following corneal melt after previous keratoplasty. This is a keratoconus patient who had keratoplasty many years ago in both eyes. Unfortunately, this eye was injured a few years later by an explosive. He has lost his lens and his iris and was operated again with a corneal transplant, which was melted. The new corneal button has to be fitted on the old cut of 7 millimeters, and of course the eye missing the lens iris diaphragma is very soft. He had had a previous vitrectomy, and in order to prevent phthisis and maybe have some visual potential, we decided to treat the corneal melting with a keratoplasty à chaud. So we had to first suture the hole in the anterior cornea as soon as possible. Suturing a very soft eye with scarred borders is not easy, and we expect to be switching and changing many sutures as long as we get some tonus in the eyeball, which we did. The sutures are interrupted 10-0 Ethylon sutures, as typical for this case. Since the risk of infection or melting is still very high, we will use interrupted sutures, as typically in this case, and we know that bulbous is reconstructed. We use here 16 separate sutures, but gradually we have to retonus the eye by changing and rechanging the two tight sutures and trying to get a symmetrical pull from all sides of this relatively small 7 millimeter transplantation. The cornea is clear in the center. We do not know how the periphery will heal, and as we mentioned before, this is an aphac eye without an iris. If we're successful and the eye keeps its potential, we may be able in a very late stage to do an additional surgery and add a scleral fixated lens or a lens with an artificial iris. To support the healing of this very inflamed cornea and bulbous, we cover the eye with an amnion membrane, hoping that the growth factor will assist a proper healing and a clear corneal surface. The membrane stays on the eye for several weeks until it melts, and a good goal would be to have a new reepithelialized cornea, which means that we have solved this primary crisis of corneal perforation after a previous keratoplasty. The membrane is sutured with vicryl sutures and can be covered later with either a contact lens or a full bandage. There's also a variation of adding a second layer of membrane or a roll of membrane if we want to block some kind of a dump or a hole in the corneal tissue. As a take-home message, the aim of keratoplasty à chaud is to save the globe rather than refractive. An amnion membrane may support the healing. I thank you very much for watching this video and hope to see you in the next videos.